All right, so we're going to be continuing on here with our hydrotherapy theory and practice series of presentations here. We're on part 15 of this series here, and we'll continue learning about some of the practical applications of it. But as we begin, I just want to remember that whenever you are navigating any health challenge or just trying to maintain health, make sure you partner with someone who has a similar philosophy of health and wellness as you do, and that the things presented here are just simply toolboxes, wellness tool kit contents that you can put in your toolbox and to help yourself with it. And just if there's any new thing, just make sure that you are checking it out with due diligence to make sure that it's going to fit what you want to do with it. Back in 1903, Thomas Edison made a statement that was quite striking and advanced. I don't think we're quite there yet with the fact that the doctor of the future won't be giving any medicine. It seems to be that doctors are giving more medicine than they ever had before. But the doctor of the future will give no medicine, but will instruct his patient in the care of the human frame and diet and the cause and prevention of disease. I'm not sure we've ever been in that particular state, but as forward thinking as that was, there was a even more forward thinking in 1885, actually. There are many ways of practicing the healing art, but there's only one way that heaven approves. God's remedies are the simple agencies of nature. That's pure water, air, cleanliness, a proper diet, purity of life, which is huge, and a firm trust in God. Most people don't take the time to develop them and learn how to use them, and they do take time, but they are inexpensive and available to everybody who wishes to use them. Drugs are expensive in both money and effect on the body. And actually, when drugs are used, it often ends up pushing the disease into a different part of the body. 3 John 1 verse 2 really focuses on the aspect of our soul needing to have as close attention as the rest of our body. And in fact, it can have a direct implication on our health. Beloved, I pray that you prosper in all things and be in health just as your soul prospers. Then Romans 12, 1 and 2 just reminds us that we are to present our bodies as living sacrifices, holy and acceptable to God, and that is our reasonable service. It's not unreasonable to ask us to do that. And do not be conformed to this world, that is, not following after worldly ideas and things, but be transformed by the renewing of your mind, that you may prove what is that good and acceptable and perfect will of God. The Ministry of Healing states that being God's creation and his habitation, i.e. being the temple of the Holy Spirit, we should spend adequate time learning about ourselves and knowing how we work. We should know how to preserve our bodies from harm and defilement. And so it's an important thing and an important incentive to taking care of our bodies to the highest level we can. Our topic today is a continuation of looking at local hot and cold use. So when I said local, it's at a specific spot or specific area on the body, using hot and cold. The goal of the hot and cold is a circulatory promotion. So it alternates the vasodilation, vasoconstriction of the blood vessels. So heat opens them up, so blood flow is increased. Cold constricts them, makes them smaller, and drives the circulation back towards the core of the body or away from the surface of the skin. The particular place where we'll start here is looking at the revulsive compress. So the revulsive compress is similar to an alternate, but the timing of the hot and cold is different. So on the alternate compress, which is the one we did in part 14, the alternate has the hot and cold being applied at equal amounts of time when they're applied. So if you are 3 minutes on with hot, 3 minutes on for cold, 3 minutes on with hot, 3 minutes on for cold, for 3 replications. The revulsive, the hot part of the equation is demonstrably longer than the cold. So there's going to be a longer warming period than there is the cold period. So it can help in relieving pain of all kinds. So pain can sometimes respond to very hot applications, and it just depends on what the pain is and how your body responds to it, because sometimes it responds better to cold, and sometimes alternating heat and cold will be more beneficial for the relief of pain. So it's just helpful to have a good idea of what the different modalities are and be able to use them. And if one doesn't work, to fall into the next one and try that approach. So he can also increase pain if it excites nerves that are associated with the inflammatory nature of the pain. So it just depends on what the basis of the pain is. If it's more vasculature based, of course, there's always going to be neurological sensation of pain, but there are different types of pain neurons. There are those that are available or designed to sense pain in deep tissue, those on surface tissue, and so there's different types of pain receptors. So it can help reduce congestion, so gastric congestion, inflammation of the gastrointestinal tract, enteralgia, acute sciatica can be helped with the revulsive treatments. Neuritis, it's inflammation of the nerves, and eye and spine irritation. So those are going to be localized to the eye or localized to the spine. So it can actually help with toothache pain by using the alternate revulsive treatment of hot and cold, remembering that the hot application is longer than that of the cold. So to begin with, you want to have the room at a nice warm temperature. It's going to be similar to a fomentation in that regard. So you're going to have a nice warm room, should be draft free. The water you're using is boiling. So it's not just hot water out of the tap, but it's going to be at a very high temperature. So you'll wring the towel free of the water. And if you do it as the illustration suggests, you probably scald your hands pretty good. So it's better to have a larger towel that has dry ends. You can dip that towel into the boiling pot of water, then use the dry ends to twist and wring out the towel. Now, then you're going to place on the area of application and cover that area of application with the towel. I think I skipped a step there. You want to wrap a dry towel around that very hot wrung out towel first, and then apply that to the area of application, and then cover with an additional towel. So essentially you have it sandwiched. You can see in the picture below that there's a nice big towel over top of another towel underneath. That is the wet pack that has been dipped in boiling water. So to make sure you communicate with the person, that they talk back to you. If it gets to be too hot, you can just lift it and rub the skin with your hand, and just kind of have some surface cooling taking place until it cools down a touch. Or you can place an additional dry towel in between to create an extra layer between the skin and the hot pack. So generally speaking, leave it in place about 3 to 5 minutes in duration. So you're not leaving it there for a longer period of time, but relatively speaking, compared to the amount of cold, it's going to be longer, considerably longer. So that's the first step, is doing the first step is like a fomentation. So regular use of fomentations we'll talk about later, but it's usually hot pack after hot pack after hot pack. But this is the hot pack that takes place for 3 to 5 minutes and gets the body in that area nice and warm and increases the circulation there. So after 3 to 5 minutes of hot, you're going to remove and place a hand towel that's been wrung from ice or cold water over the area. So the temperature depends on the person's ability to handle or react to the cold. So if you have a feeble person, you're going to want to have cooler or warmer, less cold, less frigid water, so that the reaction isn't using so much energy to do that. So you want to take into consideration the ability of the person, their physical stamina. So instead of 3 to 5 minutes, you're going to be leaving it on for 3 to 5 seconds. Then flip it for another 3 to 5 seconds, so you kind of get the cold from both sides. So about 10 seconds total before you remove it. So you had 3 to 5 minutes of hot fermentation and about 10 seconds of a cold quench, essentially, which is doing a vasoconstriction, driving the blood away. So the left-hand picture there could be a hot pack, hot water, or a cold pack, and then just putting that on to quench it. So once you've taken that off, dry the skin, and then reapply the hot fomentation, followed again by a short cold. You'll be doing that hot and cold treatment rotation 3 times. So that's a typical amount of time for doing any hydrotherapy treatment is 3 rotations of the procedure before coming to a completion. So remember, after hydrotherapy treatment, the individual should be encouraged and allowed to rest for 30 minutes prior to going on and doing any other activity, because otherwise you can end up counteracting or negating some of the effects of the hydrotherapy treatment, depending on what it is. So it needs to be in a warm, draft-free place, especially if this revulsive treatment is being done over a large area of the body. If it's on a hand or something like that, or a small area, it won't be quite as necessary to have that rest. But if it's involving a larger systemic aspect of the body, remember to rest. So the next one is alternate hot and cold to the head. So again, you're going to be doing a cycle of rotations for 3 cycles. You always start with a hot first, and then cold. The benefit of this is it increases blood flow to the area of the head that it's applied. It can help increase circulation, which is helpful for headache, and it can also help in head congestion. So that can be a mucus-based congestion, or it can be a blood-based congestion. It can be helpful for helping to remove various toxins and things that create blood vessel constriction and are part of the headache process. So some things that you need to have on hand: you need to have 2 12-inch sections of thick toweling, so a nice terry cloth towel like a Turkish towel, 2 ice bags of finely chopped ice. That increases the surface area, allows it to mold over the area more completely than you would with chunk ice or ice cubes. And then you want to have a thin cloth that's going to cover that and separate the actual coldness from the skin by a thin insulating layer. 1 hot water bottle, partly full and covered with a cloth, so you're going to have that as a key feature. And then 2 bowls, 1 of ice water and 1 of boiling water. So you're going to have some contrast there in addition. So applying this procedure, you want to position the hot water behind the neck of a prone person, behind the head. So you can kind of see this person is standing here to kind of give a better view of the toweling. You can even go up farther behind the head. If they're laying down, this person is doing it to themselves. They're not having additional assistance. But wring a toweling from ice water and apply it to the face. And then cover from top of the head to the ears. Press it down over the forehead and the temporal arteries. So the above picture shows where the temporal arteries lie, and the water therapy, hydrotherapy, is going to be affecting the flow of the blood in those areas. So change the compress every minute, and in 3 minutes, you want to remove the hot water bottle, replace it with 2 cloth covered ice bags. So you're going to be exchanging the heat for the cold. Replace the cold cloths on the forehead with hot ones. You want to make sure that they're not sopping wet and dripping. You want to make sure that they're wrung out well. So you're changing the position of the hot and cold to create a change and exchange of blood and circulation increases. So renew the compress each minute. So in 3 minutes, begin the cycle again. So within each 3-minute cycle, so you'll do 3 changes of the compress to keep the temperature more even. So in 3 minutes, you're going to do hot water to the neck. So you can use a hot water bottle again, up the back of the neck, and then cold to the face. So the back is going to be cold, the front's going to be warm. And then repeat that for 3 complete cycles. At the end of this compress procedure, you want to make sure that you do dry the hair well to prevent chilling, because then the process is going to get damp from the hydrotherapy treatments. So the towel should cover the face from the top of the head and the ears. So in this particular person here, it should go a little bit further back around. Looks like it doesn't quite reach the ears. So one thing to keep in mind is that you want to have a plastic sheet cover on the bed, so that if you're using a person who's in a bed situation, so they don't get that all wet. You want to make sure that on the face, when you have hot on the face, don't press the hot cloth into the face too much. You want to have the eyes protected from the heat. So sometimes you may even need to put an additional thickness of toweling between the eyes and the hot compress, but having it definitely available to cover the nose areas and the forehead to help relieve that congestion that is being affected. So simultaneous hot and cold to the head. So the hot and cold are utilized, but they don't change the locations of application. So what we've just seen is that they change location front to back, but this one is not. So the cold is going to go over a reflex area or a large artery, and that helps to remove blood from the head area, and the opposite effect of our previous treatment. So the previous treatment was bringing blood to the head because it was more warmth associated with it, but this is going to be cold over the reflex area. So some benefits of that is it helps to reduce head congestion in a different kind of a mechanism, and headache caused by congestion, so excess blood to the brain area. So there can be different causes for congestion, and you need to ascertain which of these treatments fits best for the particular situation. So the tools, you want to use the same tools as you had before. You just be using them in a slightly different way. So your 2 sections of thick toweling, the terry cloth towels, your ice bags of chopped ice, your hot water bottle partly full and covered with a cloth, and your 2 bowls, one of ice water and one of boiling water. So how do you apply that? So the ice bag, should be bag, to the base of the brain, so the back of the neck, and then an ice bag or cap over the top of the head. So in 2 different spots. The cold, wet towel on the hair, it helps intensify the cold. You don't want it to be wet, as in dripping wet. Should be a cold, moist towel, so that you're after the cold effect, not the wet effect. So the ice is going to go over the carotid arteries. So the common carotid arteries and the external carotid arteries are right there along the neck. And then fomentations, hot fomentation to the face, covering the ears and the forehead, keeping the cloth there so you keep the nose free and they can breathe effectively. And then finally, you would finish that treatment with a foot quench. So you have the ice bag on the back of the neck, at the base of the brain over the cerebellum area, a nice cap on the head, a cold wet towel on the hair, ice cold over the arteries, and then a hot fomentation to the face. So it's kind of a complex like head array cap. And then you'll have a finish off with a foot quench, so hot water and then cold. So keep the compresses in place till your feet are quenched. It's just called a quench because it's similar to what they do with iron when they're working with iron in a forge. Get it all nice and hot, and then it helps to quench it or temper it when they put it into water to cool it after they're done working. So this is a couple wooden buckets. You could use a plastic bucket or any other kind of a bucket to do the quenching of the feet in. These are some pretty nice looking foot baths. But as always, you can revisit the things that we've talked about here this evening at www.preparingforthetimeoftrouble.com and look there for past episodes and future treatments of this subject.